So, excellent question and an important question. How does nutrition play into this? And the fact is nutrition is crucial. And we take histories from people. What are they eating? How much are they eating? What are they eating? And then we need to look at what foods they may be sensitive to, and we need to eliminate those foods. We look at detoxification processes in some people. So there's not a pat answer for everybody. The straight answer I would give for everybody is stop eating processed foods, stop eating as much sugar as we're eating, okay? Cut down on your carbohydrates. Very straightforward. When we start off with people and we want to start seeing what's going on with them, I tell them rice, fish, chicken, fresh fruits, and vegetables. That's your diet for the next 6 weeks. They say, you're kidding. And then they start, well, how about this, how about this, how about this? Rice, fish, chicken, fresh fruits, and vegetables. Straightforward. And that means you got to shop the periphery of the store and you got to get out of the center aisles where all the processed stuff is. Now, does that eliminate everything you're allergic to? It does not. But it now clears the field so you begin to see other things that you're reacting to. So if you've got 15 things you're allergic to and you're eating all 15 of those things, you're constantly in a fog and you can't figure out which ends up. If I get rid of 10 of those things, and now you get exposed to something and you eat something and you go, oh, wait a minute, now I got gas and bloating after this, or now I got nasal congestion, or I'm more achy now that I've eaten this. Now you start able to listen to yourself again and figure out what foods make sense and what foods don't make sense. But nutrition is crucial, and we have to do a lot of work along those lines with people in order to be able to help them recover. Other questions? We do have some answers because we're able to do greater in-depth analysis of what's going on. So there are a number of different tests that we do to look at different aspects of how the gut is functioning, also what type of flora there, whether there's yeast overgrowth, whether there's bacterial overgrowth. And so we have testing that we can do for that. The next step in that is actually looking at the entire gut microbiome, all of the bacteria there, what percentages of what are there. And that's the research that we're starting. That stuff's not quite ready for prime time yet. That's why it's in the research category. But that's the next thing that we're going to be doing. And that's a very hot area of research right now. So we will get increasingly detailed in terms of exactly what types of flora are there. And we're hoping that we'll see enough differences in patterns that we'll be able to get very specific about what we want to replace in order to bring people back into balance. So, but it's a lot of specialized testing. That's what it amounts to. Yes? So is anyone coming closer to figuring out what fibromyalgia and how do we treat it? The answer is yes, we are coming closer because the first thing we're going to do is we're going to understand that fibromyalgia is a symptom, not a disease. It's a symptom of neuroinflammation. And what we have to do is figure out what set off the inflammation. And if we figure out what set off the inflammation and then we treat the residual inflammation that's there, we can talk about total recovery. And there's in fact a story in the book talking about a young woman who presented with fibromyalgia, who in fact we were able to get to complete recovery as we got the whole story out and all the aggravating factors. So fibro is a symptom of inflammation in the central nervous system. Then what is it? Now you start off on a different channel as opposed to what do I do to treat fibromyalgia? Now what do I do to treat inflammation in the central nervous system? I'm sorry, what? There is nothing wrong in the muscles in fibromyalgia. The problem is the central nervous system. We've known this for years. And anybody in the field who's doing the research will tell you that the problem's in the central nervous system. It's not in the muscles. So it's the way the brain is reacting and processing pain. So what I argue for, and what I wrote in the book, is I argue for we change the name of all of this stuff to central sensitization syndrome. The occurrence of chronic pain with a neuropsychiatric illness is a different creature than the occurrence of either chronic pain all by itself or the occurrence of depression all by itself. How do we know this? because our success rate in treating these people, we get about 50%, 60% success in treatment if you have just one of those conditions. If you have both those conditions, 9% success rate. So central sensitization syndrome, I think, is a much more accurate description of what's happened in the brain and what it is we're treating. So how it manifests is going to be different in different people according to genetic makeup, according to precipitating factors. So there's a lot involved as to why a given individual shows up here as opposed to here. Okay? But it still gets back to expressions of neuroinflammation.
Yes, first of all, I have to congratulate you for this outstanding presentation, really. A couple of things. We shared this morning this paper on bullying and inflammation. I'd like to maybe comment because I think it's a very important issue. And the second thing is everything works in circuits in the brain. And sometimes you have the inflammation and you have the pain and then you have the depression or the mood instability. Sometimes the process is so chronic that even if you treat inflammation, treat the pain, the depression may follow because the circuit is not functioning. There's no this regulative mechanism that would help you recover. So many times you have to treat the depression, you have to treat the mood problem to be able to control better because clearly one is going to affect the other. And so if you don't treat chronic depression, the inflammation will continue in many cases.
You're absolutely correct. As these conditions go on, the longer they go on, the harder they are to treat. We see brains which degenerate. We see loss of gray matter. Okay, the longer the inflammation stays in the system, the harder it is to treat, and the odds of total recovery go down with it, unfortunately. The other thing that's crucial, as Dr. Apud is saying, is look, this isn't about, herbs and spices versus drugs. This is about integrative medicine, and integrative medicine is about using all of the tools that we have available to us in order to get the best possible results for our patients. The antidepressants are crucial in the work that we do. The anti-seizure medications are crucial in the work that we do. As is acupuncture, as is manual therapy, as is the physical therapy, as is nutritional work. It's about all of it together, not one or the other. The study that Jose is talking about, and you can correct me because I only got a chance to go through it briefly, he was kind enough to send it to me this morning, is demonstrating that kids who have been bullied early in life, there's inflammation going on at least in the periphery of their bodies. Their C-reactive proteins are higher than in kids who have not been bullied. And so now this sets up a whole question of what's going to happen to these kids 10, 20, 30 years from now. We don't know the answer to that question. But we know that stress, we know that the bullying in this case sets off inflammation in these kids. And we need to pay attention to this. There is real physiologic damage being done. This isn't just about my feelings being hurt. This is about real damage occurring in the body. And we've got to be attentive to that and address it accordingly. Would you add anything else to that? Thank you. What role does hormones play in brain inflammation? So, double-edged sword. The hypothalamic pituitary adrenal axis is dysfunctional in everybody who is depressed or has panic disorder or a neuropsychiatric illness. But the adrenal glands in and of themselves are not the problem. The problem is in the centers of the brain that are responsible for regulating these issues. And so we get back to needing to address the issues in the central nervous system themselves, because that's what's going to allow for the regulation to be corrected. Same thing happens in terms of depression with the hypothalamic pituitary thyroid axis. And so that has to also be paid attention to. Now sometimes we have to do a bit of rescue, and we've got to do things in order to support the thyroid, and we've got to do things in order to support the adrenal axis. But the place of focus where we need to pay attention The problem is in the brain. The problem is in the regulation of these axes. So hormones are crucial. Now, the other place that hormones come into play is postmenopausally, okay? One thing that happens in about 20% of women as they move into estrogen loss is generalized pain and aching. And sometimes the easiest way to fix that is give them back estrogen. So hormones are a huge thing that we need to pay attention to, and they're all part and parcel of this. They feed back and forth. The more dysregulated the hormones become, the more dysregulated the brain becomes. And so you're constantly paying attention to all of this and looking for the balance. What do I think about hormone replacement therapy? That's a touchy topic. I think everything needs to be individualized. I think you can't just say straight across the board, everybody should be on hormone replacement therapy. We have gone through, I've been through this enough. We were at one point where if you didn't put women on hormone replacement therapy postmenopausally, it was malpractice. To if you did put women on hormone replacement therapy, it was malpractice. And now we've swung somewhere in between saying, well, yeah, it does make sense for some women, and we need to understand how much and when.
What is the inflammatory effect of obesity, diabetes, and other inflammatory processes in the body have?
So the question is, what about obesity, metabolic syndrome? These are inflammatory states. Diabetes is an inflammatory state in the body. And they are one of the things that can upregulate microglia. So they compound the problem. So you have problems where peripheral inflammatory conditions can excite central inflammatory conditions. And in fact, if you look at the statistics, obesity has about a 55% chance of also having problems with depression, much higher than the general population. They have a dramatically higher increase in chronic pain than the general population. And it's not simply because of the weight on the joints. It has to do with the inflammation that's going on in the body. So obesity is a huge problem, no pun intended, or perhaps intended. But obesity is a huge problem and one that needs to be addressed because it is a pro-inflammatory state in the body. All right, I thank you all very, very much. You've been most attentive. I really appreciate all of you coming this evening. Thank you.